my name is Ellie, and I'm going to be presenting on ITP, or immune thrombocytopenic purpura. It used to also be called idiopathic thrombocytopenic purpura, and I will tell you why in a second. This autoimmune disease is characterized by the body producing antibodies against its own platelets, reducing platelet count and causing bleeding. Demographics. In children, it usually occurs after a viral illness. It is super sudden, self-limiting, and it seems to resolve itself within 2 to 3 months. In adults, it occurs in people ages 20 to 50. Chronic ITP most commonly occurs in this age range, and it can be primary with no known cause. Also the reason why it used to be called idiopathic, or it can be secondary, occurring after another autoimmune disease like systemic lupus, infections like HIV, or it can be medication induced. The etiology is obviously not known, but the patho of it is basically autoantibodies are produced. They attach to the surface of the platelet to a receptor, and macrophages in the body recognize this stimulant, and they go to the platelet and they destroy it and eat it, obviously killing off healthy platelets. The bone marrow tries to respond and compensate by producing more platelets. However, it is not quick enough, and the rate of platelet destruction is quicker than platelet formation by the bone marrow. And this kind of creates like a little loop where the body continues to try but cannot, and this causes, your classic bleeding or your classic anemia symptoms, such as like malaise, fatigue, weakness, pallor, all the things. Some clinical manifestations and client symptoms, again, are going to be your things where you're fatigued, weak, and then some things that are specific to ITP, easy bruising or purpura, which are purple patches on the skin. You're going to see some petechiae, which are small red dots, prolonged bleeding from cuts or gums, recurrent or severe nosebleeds, heavy periods and prolonged periods, and internal bleeding like hematuria, GI bleeds, and intracranial hemorrhage in severe cases. Diagnostic findings: your platelet count obviously is going to be low. Average platelet count is 150 to 450,000 units per liter. In thrombocytopenic purpura, it's going to be under 150. In severe cases, it can drop down to 30,000 units per liter. Prolonged bleeding time. However, your PT and your APTT are not affected because the clotting cascade is not affected. The reason the body has difficulty clotting is because of the lack of platelets, not because the coagulation, your coagulants are off. And in some patients, antiplatelet antibodies are detected. Oh, here we go. Find my sheet. Like I just said, pathophysiologic process producing manifestations. You're going to have impaired clot formation at the vessel injury sites, small blood vessel leakage, and prolonged bleeding from minor injuries or mucous membranes. Expected findings: in severe cases, if you are unable to clot and you're just hemorrhaging, you're going to see your classic anemia and hemorrhage. Vitals, which are tachycardia and hypotension. Obviously, blood is no longer able to clot, and it can leak into the skin and cause purpura, petechiae, and ecchymosis or bruising. And again, bleeding gums and severe or recurrent nosebleeds. Treatments: corticosteroids. Your classic one is going to be prednisone. These suppress immune response and reduce platelet destruction. IVIG can temporarily increase platelet count by blocking antibody action. For Rh-positive patients, anti-D immunoglobulin protects platelets from immune attack. Removal of the spleen. This is one of the more severe routes if, medications and immunotherapies are not effective. Providers may remove the spleen because that is the main site of platelet destruction. And then in severe cases, platelet transfusions, they're only used in life-threatening conditions because, again, people with ITP, their body is just going to produce antibodies for the platelets that are being transfused. Medications like rituximab or azathioprine are used for chronic or refractory cases of ITP. Nursing care, it's just going to be your classic bleeding precautions, such as electric razors, soft toothbrushes, avoiding injections and rectal temperatures. You're going to monitor for bleeding in the skin, the gums, stool, urine, any type of excretion, fluids, anything that comes out of the body, check it for blood. And then obviously your probably skin checks are going to be more frequent than Q12. I would honestly do them Q4. Monitor labs. Obviously your platelet count is going to be trended every morning. So is your CBC and your coagulation studies. Administer medications per the order. You don't want, so if the patient is taking prednisone or another corticosteroid for their ITP, you want to give it on time and you want to give it frequently so that the body doesn't jump back to its state of severe over response of the immune system. Plan rest periods. The patient's going to be severely fatigued, so let them sleep. And supportive care is preventing falls and injury and using gentle handling during care. Simple things is when, let's say the patient is bedbound, you're turning them. Try not to scratch them with your nails under your gloves. Your badge when you're leaning down. These are things I think of. Your badge when you're laying down in front of the bed. Don't let the badge fly around and cut them in the, you never know. And then client educational needs, basically all the things I just said. Bleeding precautions, educate the patient on why and how they should do things. Medication adherence, avoiding contact sports, infection prevention. They're at an increased rate or increased risk of infection because when you have open cuts and things that are bleeding and not healing and not clotting, there's skin integrity issues and you are more susceptible to getting infection. And then when to seek help, report any signs of unusual bleeding, blood in the urine, blood in the stool, severe headaches, and vision changes. And lifestyle changes, maintain a safe environment at home and avoid drinking alcohol that can affect platelet function. That's all I got. Thank you.